And now, Wellness Wednesday, brought to you by Gladstone Psychiatry and Wellness. Care that meets you where you are.
On today's Wellness Wednesday, we're talking about seasonal affective disorder.
Greg Franklin, the Associate Director of Gladstone Psychiatry and Wellness Therapy Programs, joins us here today to talk about it. So timely. This is the time of year that, it seems like it's dark when we leave the house. It seems like it's dark when we go home. Talk to us about this season and how it impacts folks.
It's one of the most interesting things I find when I'm doing therapy is when people get the season change, sometimes after Labor Day, after we go through daylight savings time, people often will find they have changes in their mood, their energy, and as we get less daylight for our bodies, we often will get into these spaces where we just do not, we lose energy, we can't follow through with tasks, and we don't complete things like we usually do. So it's sometimes hard to actually notice what's happening to you until it's already in that space.
Yeah. And so for people, I mean, when we talk about typical depression all year long, and then the seasonal affective disorder, what are those key differences that you can spot out? Like, oh, this is a seasonal thing, not a year-long,
Yeah, clinical depression can happen at any time of the year, and those symptoms are good. They're going to be a similar set of patterns of behavior. The seasonal aspect typically happens in those winter months when we have less daylight. We're effectively with less daylight, we're experiencing more disruption in our mood transmitters like serotonin, melatonin, and our bodies respond differently to that. And sometimes it can be hard to tell what is happening for you, but clinical depression can happen year-round.
Yeah.
I hear people say, oh, you just need more vitamin D. Open up the, take vitamin D. What are some strategies for managing it?
One of the most common ones that people use for seasonal affective disorder are using light therapy. There's a lot of medical grade devices, but you mentioned the vitamin D. Vitamin D is typically only processed with ultraviolet light, which most medical devices do not have. So talking to a prescriber about what ones you are specifically trying to use can be really helpful. In therapy context, I actually usually talk to people about trying to find ways to get outside even when it's cold and other strategies to do that. A lot of people like plants and have little gardens, so those plant lights typically have UV and can supplement in that way as well.
Interesting. And so this kind of depends, I guess, on where you're positioned in the country, depending on, I guess, the seasons. But have you been noticing more people coming? Because I feel like it's been very cold from the start. It was a pretty drastic change, I feel like, from the weather this year. Have you been seeing more people call in for this?
I feel like we mostly skipped fall this year, but it's pretty common when we have this change in season and we're just kind of forced indoors more, that those sets of symptoms can just come on very quickly. So typically one of the things we look at is trying to, if you have a behavior pattern that changes for more than 2 weeks at a time, we're not talking like, we have 3 days where it's cloudy and it's really gloomy and you just kind of feel like you just want to stay in bed under the covers. This is more like when you have every day you're struggling to take a shower, get out of bed, complete tasks at work, and other aspects like that.
Okay, so those are some of the signs that when you know you should seek help, or if you see it in other people, maybe kind of urge them to seek you out. So then how do we find you? How do we find that professional help?
Well, there's a lot of therapy clinics. Obviously, I work with Gladstone Psychiatry and Wellness, and we have a lot of psychiatrists and therapists who do an amazing job at supporting folks with their mental health, reaching out to us and connecting. But if people have children, talking to your school's counselors as well. But looking for those changes in patterns of behavior to ask for help. If there's any kind of medical emergency, looking out for 911, 988, and the mental health hotlines, suicide prevention awareness. It's always important this time of year.
And your website is gladstonepsych.com,
Gladstone
and you have offices, where are your offices located?
We have offices located in Columbia, Bethesda, Frederick, here in Baltimore, and up also in Hunt Valley.
Okay, so it helps just a phone call, a website, and a drive away.
Yes.
All right. Great.
Thank you so much.
Thank you so much. So timely.
Thank you so much, Tom.
Appreciate it.
Wellness Wednesday on WJZ at 9 is brought to you by Gladstone Psychiatry and Wellness. Care that meets you where you are.